Thank you, Honorable House Chair. Minister, Addington Hospital is one of the main hospitals in eThekwini municipality, providing crucial health services to hundreds of thousands of citizens in the city. Recently, emergency services in Durban have been notified that Addington Hospital will not be accepting any new patients, and the emergency services were asked to divert patients to surrounding hospitals because the lifts are inoperable. In June, patients had to go without breakfast because the lifts in the 16-story building at Addington stopped working. And KZN Health MEC Nomagugu Simelani Zulu voiced her unhappiness over the erratic functioning of lifts. In the light of this unacceptable situation, what proper maintenance plans with consequence management are in place to ensure that our hospitals throughout the country do not suffer the same problems as Addington Hospital? Thank you.
Honourable Minister.
Thank you very much. I may not be au fait with what happened in Addington, specifically on the day that you're referring to, Honourable Member, but it's something that we would have to just follow up to see if they've attended to. The real issue is that the problem of poor maintenance is a problem that we have throughout the whole country, that we have actually estimated that at this moment we need about 2 billion rand to be allocated to the maintenance of all the hospitals. That is the work that is actually currently in place. We're working on that. So all the hospitals should have that plan for maintenance. Those which are not should probably be on the 10-year plan for refurbishments, so that the parts that need to be attended to are upgraded. So there is a plan for all. In fact, when we talk about this plan to fast-track the refurbishment of the facilities, we are hoping to be able to deal with and attend to all the facilities at the same time. So we are aware of the problem of the poor state of a number of the facilities. We are working on that. Thank you.
Thank you. Deputy Speaker, the basic role of education is to mold our children into productive, capable and hardworking members of society. To the Minister, the progenitor of CSE, Comprehensive Sexuality Education, Dr. Alfred Kinsey, conducted fraudulent research to prove that children were sexual from birth. In Table 34 of his book, Sexual Behavior in the Human Male, Kinsey documents the abuse of a number of infants, toddlers, and older children from 5 months to 10-year-olds who were sexually abused by pedophiles to induce orgasms that were timed with a stopwatch over a 24-hour period. Noting that comprehensive sexuality education is to be introduced into the school curriculum in 2020, will the Minister reveal to the parents, the teachers, teacher unions, community organizations, and other stakeholders what the actual content of CSE is?
Thank you.
And to inform this House when public meetings will be held to discuss and inform our communities on the content of comprehensive sexuality education. Thank you.
Minister.
With due respect, the question was about transport, not sex. So what is going to happen next week, Chair? In the portfolio committee, we're going to give a comprehensive report about the issue that the member is raising, but now we're still talking transport. And we are ready because we are quite agreed with him that it is important to talk about sex at some stage in our school curriculum, but not now. We're talking transport now.
Thank you, Minister, for answering the question. Thank you very much.
Thank you. Minister, there are hundreds of township schools without proper sport facilities and activities. And this has freed up the time of our learners and exposes them to other social ills, which are prevalent in their communities. And as a result, many of our children are excluded from developing or discovering sporting abilities, which further increases the lack of transformation in our national sports teams. Minister, has the department had discussions with the Department of Basic Education to introduce sports back into our schooling system? And if so, what timeframes have been given for this? Thank you.
Thank you. Minister.
Well, thank you, Honorable Member. We share your concern on the facilities, particularly in schools, public schools. Of 25,000 schools we have, the former Model C schools seem to be at an advantage insofar as that is concerned. The facilities at the local level are mainly provided by municipalities and provinces, and the budget, when it comes broadly to sport, is not at a level which would be able to deal with the challenges which we have. So I think that your question is well placed, and we'll continue to work with our provinces, we'll continue to work with the locals, but you will also realize that when it comes to sport, government alone is not going to be able to deal with the massive demand on the ground. That's why we talk more of engaging, particularly the private sector. Thank you.
Thank you, Deputy Speaker. I hope that the Minister, I have to couch my question in such a way, that she answers it, but Minister, there's a huge attrition rate from grades 1 to grade 12. And there are many reasons for this attrition. One of the reasons certainly has to deal with inadequate infrastructure. And recently the case of Michael Komape, who drowned in the pit latrine as a result of insufficient or inadequate infrastructure, is a case in point. So what is the progress made in eradicating pit toilets in our schools, and the proposed timeline to ensure that our children have access to safe sanitation services, thereby increasing their chances of being enrolled for grade 12 one day? Thank you.
Thank you, Honorable Thring. Minister.
Chair, the member is not very accurate. Where we agree with him that our dropout rate after the basic education part, which is from grade 1 to 9, is alarming and quite disturbing. But as a country, we boast that we have almost universal enrollment at a basic education level. We start experiencing levels, challenges when it goes to grade 10 to 12. So the falling of children in pediatrics has nothing to do with the fact that we lose more than 30% of learners between grade 10 and 12. And we have done an investigation with the State South Africa and ourselves to try and understand what are the causes for this high dropout rate at that FET phase. Amongst others, Chair, what has come out from our studies, it's problems of parenting, which is also has much more to do also with the violence, if I care to say that, because young people, by the time they're in grade 9, they're teenagers, they really, if they don't have strong parental support, they really do what they want. But the other major problem, which is a concern, which we have picked up and are acknowledging, that it's poor foundations, that by the time they go to the FET phase, they are not coping. So the Komape story is unlinked because at that level, we have full registration. So the problems are different, but acknowledge that's a problem. And if we had time, Chair, I would say what are the interventions we're doing? Part of the interventions we're doing was to look at our progression policy to see if indeed we can encourage more learners to study. What we've agreed in this term also is to ramp up at the foundation phase, because it's a deficit that children go up in the system which make it difficult for them to finish at the FET phase. That's the answer. And yes, as I say, for a time, we'll explain fully what are the interventions, but I'm agreeing with the member that there is a problem of dropout rate, not at the Komape level, but at the FET phase.